Hello, my name is Panahi and I'm a biological sciences student at the University of Calgary. Today I'll be presenting my summer project titled Neurocognitive Testing in Postural Orthostatic Tachycardia Syndrome in long COVID patients with normal saline. Postural Orthostatic Tachycardia Syndrome, or POTS, is a form of autonomic dysfunction that is especially common in young women. It is characterized by a heart rate increase of 30 beats per minute or more when standing without a significant drop in blood pressure. This abnormal response can lead to symptoms like dizziness, fatigue, palpitation, and brain fog. Many of these symptoms are linked to low blood volume and reduced blood flow to the brain, which can cause difficulties with focus, memory, and mental processing. Long COVID is a post-viral syndrome that develops after a COVID-19 infection where symptoms persist for more than 12 weeks. These symptoms often include fatigue, autonomic dysfunction, and brain fog, very similar to what we see in POTS. Research suggests that this may be related to neuroinflammation and autonomic dysregulation, again pointing to possible overlaps between the two conditions. Now, the main topic of our research, brain fog. When patients talk about brain fog, they often describe a range of challenges, including memory problems, mood swings, fatigue, difficulty finding words, dizziness, or lightheadedness. These symptoms can be incredibly frustrating and can greatly affect a person's quality of life, especially when there are no clear treatment options. Hypothesis and aims. Our study focuses on whether saline infusion can improve these cognitive symptoms. We hypothesize that objective measures of neurocognitive function will improve in long COVID and POTS patients after infusions of normal saline. Our three aims are to examine whether individuals with long COVID and POTS show reduced cognitive performance compared to healthy controls, to investigate whether the brain MRI scans of these patients differ from those of healthy participants, and to test whether acute blood volume expansion through IV saline improves cognitive function in long COVID and POTS patients. We're including participants between 18 and 60 years of age who can provide informed consent. Eligible groups include patients diagnosed with long COVID or POTS who are experiencing brain fog, and healthy control groups without brain fog. We're excluding individuals with other causes of POTS, anyone who cannot safely withdraw from medication, those with claustrophobia or other complications that might prevent them from doing an MRI, and individuals unable to provide consent. Our methodology is a double-blinded, randomized, placebo-controlled crossover study. This means that the participant will receive both saline and a placebo infusion in separate sessions, and neither the participants nor the researchers conducting the test will know which infusion is being given. This design allows us to control for placebo effects and compare results within the same individuals. To measure cognitive performance, we use three main tasks. The trail making task, which tests processing speed and mental flexibility. The heartbeat counting task, which measures interoceptive accuracy or how people can sense their own heartbeat. And the CANTAB, a computerized battery that evaluates attention, memory, and reaction time. These tasks help us objectively measure the brain fog that patients experience. And so far in our analysis, we have 6 participants in both the trail making and heartbeat counting tasks. We found no significant difference between the low and high volume saline infusions, so between the placebo and actual test infusions. However, because the sample size is still small, these findings are preliminary. In conclusion, while these results are not yet statistically significant, they point toward a possible improvement in mental clarity after saline infusion. This suggests that expanding blood volume may temporarily enhance brain function in patients with POTS and long COVID. Recruitment and testing are ongoing, and a larger sample size will be critical to determine whether these trends hold true. Ultimately, our goal is to better understand the physiological basis of brain fog and explore whether saline could be a simple short-term intervention to improve cognitive function in these populations. Lastly, I want to thank you for taking the time to listen. I'd like to acknowledge my supervisor, Dr. Keshavarz, the research team at the Autonomic Research Lab within the Libin Cardiovascular Institute, and our study participant for making this work possible. I hope this research helps move us closer to understanding and treating brain fog in long COVID and POTS. Thank you.